staying employed, expanding healthcare and community services, and lowering out-of-pocket expenses for disability support. Minister of State for Social and Family Development, Goh Pei Ming, says these are among the top concerns raised by persons with disabilities and their caregivers as the government task force wraps up more than 30 engagement sessions. Mr. Goh leads the task force that looks at ways to support the disabled community.
Many families ask how we can better expand and support inclusive hiring. Our SPED schools, our employers also emphasize the importance of preparing our persons with disabilities for employment early while they're still in school. Many employers shared they are open to hiring, but they want to be fair to their employees with disabilities and ask how, as employers, they can properly support these employees in building up their skills and allowing them to contribute meaningfully in their place of work.
Mr. Goh adds that beyond the workplace, many families are concerned about long-term care. They are calling for better coordinated adult disability services that are both accessible and affordable. These services must also do more than provide care, but ensure that persons with disabilities live more independently and stay connected to the community.
For others who may not be work-ready, their caregivers are concerned if they can get into adult disability services, some of which can be near capacity in some areas. So caregivers also ask if our persons with disabilities can receive better healthcare support and continue to live within our community and be supported by our community.
Employers and caregivers are calling for stronger support to help persons with disabilities build meaningful and lasting careers. Businesses say shared job coaches and greater manpower flexibility could make inclusive hiring more sustainable. Families are also urging seed funding and business mentorship to create alternative job pathways tailored to individual strength. Chloe Teo finds out more.
Heritage business Kim Chu Kway Chang has been around for more than 80 years. Its legacy is built around tradition, yet it continues to evolve even in the way it hires. A manpower crunch in 2009 prompted the firm to begin inclusive hiring. Today, persons with disabilities work across both its production floor and retail operations.
We really truly appreciate this effort to be able to work with them, and they're working with us at the same time to provide this heritage business and help us to expand this effort.
But Mr. Wong says employers need more support to scale inclusive hiring. He suggests assigning shared job coaches across clusters of SMEs.
A trainer might find themselves having to travel around different parts of Singapore just to look after one business, right? But just imagine if we can encourage our businesses here, our business communities here, to just at least hire one PWD. We're not asking much. And a trainer could be looking after the entire precinct. I think it saves a lot of resources, and it might also even be better for our agencies to look into offering better work package for their own employees because there's volume.
For employers like KCKC, inclusive employment starts with adapting the job to suit each person's strengths. But families say that's only one part of the picture, because while some persons with disabilities thrive in workplaces like this, meaningful employment can look very different for others. That was the reality William Tan faced while planning for the future of his son, who has autism. Newspaper deliveries, supermarket shelving, gardening. Nothing seemed to click. So he built a vending machine business around the tasks his son naturally enjoyed doing.
Currently, the whole system seems to be preparing kids to do jobs that even normal kids or neurotypical kids may not want to do. If you think about it, a lot of these vocational jobs for special needs people are what? F&B, laundry, horticulture, things whereby in terms of working hours, intensity of a job, the heat in the kitchen, all these things are quite difficult.
But finding affordable locations, navigating commercial rents, and raising the initial capital still remain challenges. Mr. Tan adds that families shouldn't have to build these pathways on their own. He hopes for seed funding to help families start micro-businesses and business mentorship to turn ideas into sustainable employment.
Caregivers hope their loved ones with disability will have better insurance protection. One also suggests a special community health assist scheme or CHAS specific to the disabled. They believe that these will be better alleviate their lifelong costs of living with a disability. Chloe Teo reports.
When his 6-year-old son was diagnosed with a rare genetic disorder, Phua Wee Seng's family had just weeks to decide on a life-saving stem cell transplant. The treatment would cost around $400,000. Even after government subsidies, they were told they needed to secure a $100,000 financial pledge before the procedure could go ahead.
I understand the part on sharing of risk, but to put a certain hard stop because there's a regulation and requirement, and not understand the challenges of the family in terms of finances and also the urgency of the matter to get the treatment ongoing, I think there needs to be a greater empathy and understanding of the family situation.
Mr. Phua is also the executive director of the Rare Disorders Society Singapore. He says financial uncertainty is a common concern amongst the roughly 280 families the charity supports. While MediShield Life provides universal basic coverage, many families also buy private integrated shield plans to reduce out-of-pocket costs for catastrophic illnesses. But Mr. Phua says some children with rare diseases are diagnosed during insurers' waiting periods or face exclusions for pre-existing conditions. He also hopes families navigating complex conditions can receive better care coordination.
Somebody who was able to guide us through, from a lens of a patient journey, right? Guide us through the different milestones and transitions. So that would actually be very helpful to let us know what are we potentially looking at and what are the options available. Instead of us having to really scramble while still giving care, scramble through to find all this information and put on the table for discussion.
For many others, the financial burden doesn't end after a one-off procedure. Living with a rare neurological condition, diabetes, and an amputation, Sheldon Humphrey's biggest expenses are the ones that rarely appear on a medical bill. Basic essentials like diapers and cleaning supplies cost the 56-year-old around $200 every month. While some charities and assistance schemes help, much of that support is temporary or periodically reviewed.
My disability is not yearly, and it's quite a challenge actually, always going back and trying to get the same thing and then realize that it drops because you might have a temporary job. And I think that's also an impact because even with the temporary job, right, it doesn't cover the cost of other medical expenses.
Among the ideas discussed during the Taskforce engagements is a disability healthcare card, similar to the Community Health Assist Scheme, or CHAS. Mr. Humphreys believes such a scheme could help subsidize more everyday healthcare needs, from GP visits to mental health support. He hopes this will move the needle on encouraging people to seek treatment earlier, rather than delaying care because of cost.